I'm Dr. Anderson with North Texas Plastic Surgery, and today we're talking about the 5 most commonly requested plastic surgeries for men. I think of these in 2 sections, above the neck and below the neck. First, below the neck is male chest sculpting. You may have also heard of this referred to as gynecomastia surgery or male breast reduction. Then we're going to talk about liposuction, also high definition liposuction. When we're moving above the neck, most common is rhinoplasty or nose job, followed by blepharoplasty or lid lift, and finally facelift. So if we want to dissect each one of those a little bit further, moving on to the male chest surgery, what I'll commonly see is one of a couple things. A slightly younger guy comes in, may have some chest discomfort, and feels specifically around the nipple area, there's excess tissue that can feel like a little rubbery ball, sometimes with a little bit of fat mixed in, that he probably noticed around puberty and then just never went away. So that, I'll do a physical exam and determine that that's what's going on. And sometimes we need to order some additional lab tests to make sure of that before we do surgery. The other type that I'll see is a guy that maybe had some weight fluctuations and has more of a fatty tissue. What's important to note when I talk to guys about chest surgery is that every human, no matter how you were born, has some amount of breast tissue. So this is a normal thing. It's nothing to be embarrassed about. However, if you don't like it, we can fix it. For the overwhelming majority of my patients, I will use very small, discrete incisions, either in the hair-bearing portion of the armpit or a combination with under the areola or the nipple, the dark skin coloration. That 3-6 months after surgery is nearly imperceptible. So it's not even something you have to worry about when you're at the beach. When we're moving down to liposuction, I'll do one of several procedures. Some guys just have some extra over their abs, especially around the belly button area. That's whatever they do in the gym won't go away, or over the flanks as well, or any combination of those. When I'm doing the abs, what's commonly requested is what's called high definition liposuction. So we're not talking about liposuction from the 80s where you look just flat and weird and sciencey. High definition liposuction is going to show off the underlying musculature so you can actually see the hard work from the gym and those abs and allow them to shine through, and also looking very natural, unlike liposuction from decades ago. When we're moving above the neck, we'll first start talking about rhinoplasty. What a lot of guys will see is a big hump that they don't like. That's some combination of bone and cartilage, and we'll discuss that at your consult and how to address those things. The other thing that guys will complain about their nose is a bulbous or a round tip. Both of those things can be addressed in surgery, and again, we'll talk about it at consult. If there's breathing issues, another aspect that we'll talk about and can additionally be fixed. The next procedure is the lid lift. Most frequently, when guys are coming to see me for that, it's the upper lids, and they just feel like their eyes look tired, that maybe their wife or loved one is saying that they have some extra skin or it's starting to sag. And that ends up being a fairly simple procedure to open the eyes and make it look younger without having a surgery look or that you've, been done. Upper lids are one thing, lower lids are another. Slightly less common, but still frequent for men. That can help reduce the appearance of under eye bags, slight discolorations, or extra skin that's in that area. And finally, male facelift. So we tend to think about that frequently for women, but male faces age in the same way as well. We'll get decreased fat and kind of descent of the tissues that happen over time. And what a lot of guys will notice is along their frown lines that the tissue behind is kind of creeping forward, and they'll have that pinch there. We call that a jowl. Additionally, they may see some turkey neck or extra skin there that's just they're not happy with and they want to look more youthful and rejuvenated. Facelift can treat all of those things with a surgery that has a small incision that kind of goes around the ear, stays nice and hidden, and get that tucked up and rejuvenate the face. For more information, or if you want to schedule a consultation, phone number on the website is below. If you like this content and want to see more of it, don't forget to like, comment, and subscribe.